Welcome to this edition of the Sunoh.ai podcast. I'm Adam Silati. Providers have long asked for changes to streamline the complicated process of documenting patient care within an electronic health record. Now, thanks to ambient listening technology, physicians feel they are finally being heard. Sunoh is an AI-powered medical scribe. It listens during the visit and prepares a draft of the encounter with the medications, allergies, symptoms, diagnoses, order entry, and more documented in their proper places and ready for the provider to review and approve. Sunoh is available to users on any EHR, and it directly integrates into eClinicalWorks, Epic, and Cerner, with more integrations on the way using the Smart on Fire framework. Today, we hear from Dr. Ganesh Balu, a pain management specialist and early adopter of Sunoh.ai, who shares his experience using ambient listening to improve his clinical documentation and save as much as 1 to 2 hours every day. Dr. Balu, when you think about all of the obligations and responsibilities providers have, why is improving the documentation experience such an important area to focus on?
I'm an MD. I practice comprehensive pain medicine in the state of Delaware. We have 3 locations in Delaware. In pain medicine, documentation is a key. We don't want to keep typing, and when we do typing, it's a lot of times it's repetition of same sentences and words. And also when we use templates, a lot of times it's a copy and paste. For physicians of my age, where I'm reaching 60 years this year, one of the key points is we want to be efficient in documenting patients' interaction and also cut down on typing. The typing in the EMR is one of the biggest burnout causes, in my opinion. And also, when we are typing, we are not looking at the patient. That's also a big, to me, a negative attitude towards the patient. Most of my patients who are expressing pain, they use gestures, they want to talk their experience. And I want to be able to capture their words and their sentences and improvise on my documentation.
And what are the benefits of using an AI-powered ambient listening scribe technology like Sunoh in medical practices, or perhaps more specifically in a pain management setting?
So in pain management, a lot of times patients present with similar problems when we are taking care of a patient with chronic low back pain. The patient is coming for follow-ups for the same complaints. So it becomes very difficult for the physician to make the notes unique from month to month. So most physicians either they copy and paste from the previous template or previous progress note, and physicians of our age who have gone through some audits, we find that the insurance companies or the payers complain that it's a cut and paste of the same progress notes over and over again. So what Sunoh AI has given me is the opportunity to capture different interactions that we have on a day-to-day basis with the patient. And patient complaints are recorded the way the patients are describing. And since it changes every month and every time they come and see us for follow-ups, it is uniquely different. In my opinion, that is the strength of Sunoh AI.
How much of an impact is Sunoh having on your time to document visits, and what is required of you, the physician, to successfully complete your notes?
Sunoh AI, it cuts down on my typing, which at the end of the day can be painful for somebody like me who has some cervical radiculopathy symptoms. So to me, Sunoh AI is a godsend. It has helped me to uniquely document patients' interactions and patients' reporting of their symptoms to me. And also it has helped me to quickly finish the note. It is saving significant amount of time. I must say 60-70% of the time is saved because we're capturing all the patient's complaints and data that they're presenting with. For a regular follow-up, if we are starting with a template, then the total time is now dedicated to the patient. If the patient is given 15-20 minutes to spend with us, that is patient's time, and we are giving it back to them. And the patients feel very empowered, and they're able to have a good conversation, and they understand that the AI scribe is listening, and they get to see it. They get to see that physician immediately captured it into the progress notes. So it's the patient's story. The story is completely recorded the way the patients talk. So just to summarize, Sunoh.ai contributes significantly for day-to-day medical practice. It really cuts down on physician burnout, cuts significantly on typing, improves patients' interaction that we are capturing with the uniqueness of patients. And in my opinion, it does help up to 60 or 70% saving of time that is that was previously dedicated to charting. And ultimately, it adds significant satisfaction to the patients because all the time was dedicated for them instead of charting.
Well, thank you to Dr. Balu for sharing his time and his experience with us on today's eClinicalWorks podcast. If you would like to learn more about Sunoh, visit Sunoh.ai. And practices on eClinicalWorks can speak with their strategic account manager or business development contact. Make sure to subscribe to the Sunoh.ai podcast and look out for more interviews on YouTube, Apple Podcasts, Spotify, and Sunoh.ai.